Welcome all. We are presenting this M Excellence Fast Track series. The Fast Track series is actually the trailer of audiovisual discussion. We are going to talk about diabetic nephropathy today. And before starting that, we should remember November 14th is the World Diabetes Day and November 15th is International Pathology Day. So on this particular occasion of 2 days, we are going to talk about diabetic nephropathy, which is very important in Indian patients. And we are going to talk about only the important pathology finding of diabetic nephropathy today, not the clinical scenarios. And in this particular picture, we are seeing the normal glomerulus and we are seeing the open capillaries. Blood filters through, helps in formation of urine. Now we are seeing the first change that is seen in cases of diabetic nephropathy, that is capsular basement membrane thickening. This is the first change that is seen. Next important finding, which is the most common finding seen in cases of diabetic nephropathy, is a diffuse glomerulosclerosis. You can see the arrow pointed towards that. Diffuse glomerulosclerosis. And most characteristic finding that is seen in cases of diabetic nephropathy is nodular glomerulosclerosis. You are finding this nodular glomerulosclerosis. This is a past tense. This is nodular glomerulosclerosis. And first clinical finding that you will get, that is microalbuminuria. Microalbuminuria. And we have to remember there are two criteria are there. One is 30 to 300 milligram. There are two criteria. One is 30 to 300 will be constant. Another is 30 to 300 milligram of albumin that is being collected over 24 hours of urine collection. 24 hours of urine collection. And another is 30 to 300 milligram is going to remain constant. This is 30 to 300 micrograms per milligram of creatinine on spot collection. Means urine is going to be collected and creatinine level is going to be calculated, and from there albumin level is also going to be calculated. And if it's between 30 to 300 microgram per milligram of creatinine, that is going to be termed as microalbuminuria, and this is much more preferred today. This is on-spot criteria. And other spectrum and other important point regarding diabetic nephropathy, hopefully we might decide to upload that part of diabetic nephropathy later. We want to know how do you like this particular presentation. We also want to know in future both a competitive examination or your MBBS vivas whether this is going to be helpful. We just like to hear from you. Follow us in the Facebook, Twitter and YouTube. Thank you.